Vitamin D.
Vitamin D, okay, which is also known as calcitriol, okay. Just a minute, okay. So can you see the slide?
Yes, ma'am.
Okay, today we'll be studying about the vitamin D, okay? In the next class, we'll be discussing about the parathyroid hormone and calcitonin and the roles of this hormone in maintaining the calcium homeostasis, okay? Today we'll be talking about vitamin D. Okay, can you see the slide? There are three hormones, as you said, okay? Calcitriol, this is the active form of vitamin D, and parathyroid hormone and calcitonin, okay? All these hormones helps in maintaining the calcium homeostasis in our body, okay? So first we'll be talking about vitamin D. Have you studied about vitamin D in your previous classes? Yes or no?
No, ma'am.
Okay. So vitamin D, okay, we'll be studying. So it is also known as anti-rickettic factor because deficiency of vitamin D leads to the rickets, right? So it prevents rickets, so it is also known as anti-rickettic factor, okay? And it is also known as sunshine vitamin because vitamin D is synthesized in the presence of sunlight, okay, UV rays, because as its provitamin form, okay, that is 7-dehydrocholesterol, which is the intermediate form during the synthesis of cholesterol, okay? That is the main precursor for the synthesis of vitamin D, okay? So as its provitamin form present in the human skin is easily converted to vitamin by irradiation with UV. So we'll be studying how vitamin D is synthesized, okay, in the presence of the sunlight in the skin. Okay, now coming to the chemistry of vitamin D, okay, mainly the ergocalciferol, okay, there are two types of vitamin D2 and vitamin D3. Vitamin D2 is also known as ergocalciferol, okay, which is mainly of plant origin, whereas vitamin D3, it is of animal origin, okay. So this ergocalciferol, which is the vitamin D2, okay, it is produced by irradiating ergosterol. Ergosterol, it is found in the plant and yeast. For example, if you see, this is the structure of ergosterol, okay, it have the 4 ring A, B, C, D, like the structure of the cholesterol, okay. So, under the presence of the UV light, it is converted into ergocalciferol, which is vitamin D2. Okay, vitamin D2, it is of plant origin, which is found in yeast and in the plant. Okay, and next is vitamin D3. Okay, and vitamin D3 is of animal origin and can be produced from 7-dehydrocholesterol. As I said, this 7-dehydrocholesterol, okay, it is the intermediate during the synthesis of cholesterol. In the presence of the UV light in the skin, okay, this 7-dehydrocholesterol is converted into cholecalciferol. Okay, this is the name of vitamin D3, cholecalciferol. Okay, see, cholecalciferol, which is the vitamin D3. Okay, 7-dehydrocholesterol, it is found in the skin. Okay, under the presence of the UV light, it is converted into vitamin D3, which is cholecalciferol. It is of animal origin. Okay, so both of these, okay, 7-dehydrocholesterol and ergocholesterol, okay, ergocalciferol. During the activation of this provitamins, both of these 7-dehydrocholesterol and ergosterol, the ring B is clipped. See, this is the structure of. Hello, can you all hear me? No?
Yes, ma'am.
Yes, ma'am.
Okay. Okay, see, this is the ring A, B, C, D. Okay, during this, under the presence of the UV light, ring B is opened. See, ring B is opened. Okay, between the carbon number 9, between the carbon number 9 and 10. If you count the carbon numbers, see carbon number 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, between the ring B is clipped. This is ring A, B, C, and D. Ring B is cleaved between the carbon atom 9 and 10 to produce the vitamin D2 and D3. Okay, if you see the structure, see here, ergosterol. Okay, ergosterol in the presence of the UV light is converted into ergocalciferol. Here is also the B ring is opened at the carbon number 9 and 10. Okay. The structure between this 7-dehydrocholesterol and ergosterol, if you see, the between this structure, the only difference is the presence of the double bond and methyl. This ergosterol contains this methyl group as well as the double bond, whereas this 7-dehydrocholesterol, it have that, this ergosterol have additional methyl and double bond. Okay, both of these are the provitamins, 7-dehydrocholesterol and ergosterol. Now, absorption, transport, and storage of vitamin D. It is absorbed from the small intestine. Okay, and bile is essential. Why bile is required for the absorption of vitamin D? Do you have any idea? What is the role of bile?
Vitamin D is fat soluble.
Very good. Okay, vitamin D, it is a fat soluble vitamin. So, like other fats, okay, for the absorption of the fat, you require the bile, because bile helps in the formation of micelle, okay, micelle, and that helps in the absorption of fat as well as the fat soluble vitamin that is vitamin A, D, E, and K. Understood? Because the bile helps in the formation of the micelle and helps in the absorption of fat as well as the fat soluble vitamin like vitamin A, D, E, and K. Okay, so bile is essential for the absorption of vitamin D. Okay, and once it is absorbed, okay, it is then transported into the circulation through the lymph, and it is bound to alpha-2 globulin. Okay, alpha-2 globulin, it is the transport protein. That means it helps in binding or transporting the vitamin D throughout our body, and it is distributed throughout our body. Okay, vitamin D, and mainly the liver stores the small amount of vitamin D. Okay. Now coming to the synthesis of vitamin D3. Okay, vitamin D3 is obtained from 7-dehydrocholesterol. Okay, 7-dehydrocholesterol, which is present in the skin epidermis. Okay, under the presence of the UV light. First, it is converted into the pre-D3, and it is again undergo rearrangement. Okay, it undergo thermal induced rearrangement to form vitamin D3, which is cholecalciferol. Understood? Vitamin D3 is cholecalciferol, which is the inactive form of vitamin D. Okay, cholecalciferol. See, the sunlight break the ring B. See, we have already discussed, right? This is ring A, B, C, and D. Ring B is opened in the presence of UV rays. Okay, and leads to the formation of vitamin D3, that is cholecalciferol. This is the same thing, 7-dehydrocholesterol under the presence of the UV light, which is present in the vitamin D is synthesized in the Malpighian layer of the epidermis. Okay, it is synthesized in Malpighian layer of the epidermis. Cholecalciferol. Cholecalciferol is the inactive form of vitamin D. Okay, and once it is synthesized, once vitamin D3 is synthesized in the skin, then it is transported to the liver. Okay, it is transported into the liver, where it undergoes 25 hydroxylation. Okay, where it undergoes 25 hydroxylation, and it leads to the formation of 25 hydroxy cholecalciferol. Okay, hello.
Yes, ma'am.
Okay, okay, you all are hearing me, no? Okay, so first it undergoes 25 hydroxylation. That means in the 25 position, there is addition of hydroxyl group. Okay, and it leads to the formation of 25 hydroxy cholecalciferol, which is also known as calcidiol. Why it is known as calcidiol? Because it already have hydroxyl group in carbon number 3. Now another hydroxyl group is added in the carbon number 25. Okay, and this reaction takes place in liver. Now this 25 hydroxycholecalciferol is into the kidney. Okay, in the kidney it undergo 1-alpha hydroxylation. That means hydroxyl in the carbon number 1, okay, and leads to the formation of 125 dihydroxy calciferol, which is also known as calcium, the active form of vitamin D. Understood? Vitamin D, first it is synthesized in inactive form, which is called, okay. First it undergoes 25 hydroxylation in the liver. Next it undergoes 1 hydroxylation in the, okay. It undergoes hydroxylation in the carbon number 1 in kidney and leads to the formation of calcitriol. Okay, now it has the hydroxyl group in carbon number 1, carbon number 3, and carbon number 25. Okay, for this reason it is known as calcitriol, which is the active form of vitamin D. Okay, similarly in the kidney, okay, sometimes if there is high level of calcitriol, then this calcitriol, okay, that is 25 hydroxycholecalciferol, it is acted upon by the renal 24 hydroxylase to form 24-25 hydroxycholecalciferol, which is the inactive product. Okay, understood? If there is high level of calcitriol, then you don't need to synthesize the calcitriol. Then at the time, this 24 hydroxylase get activated, and it leads to the formation of 24-25 dihydroxycholecalciferol, which is the inactive product. Okay, normally this hydroxylation reaction, it requires the reducing equivalent like NADPH, okay, cytochrome enzyme system, as well as oxygen. Okay, all the hydroxylation reaction within our body, it requires the reducing equivalent NADPH, oxygen, and cytochrome P450. Okay. Now coming to the regulation of the synthesis of 125 dihydroxycholecalciferol, it is the short form, okay, this dihydroxy means cholecalciferol, which is also known as calcitriol, which is the active form of vitamin D. Okay, the concentration of this calcitriol is regulated by the plasma level of calcium and phosphate. For example, if there is low phosphate within our body, then what will happen? It directly activates the 1-alpha hydroxylase enzyme. Okay, 1-alpha hydroxylase enzyme, and it leads to the formation of 125 dihydroxycholecalciferol. Because this 1-alpha hydroxylase enzyme is present in kidney, right? In the liver, 25 hydroxylase enzyme is present, and 1-alpha hydroxylase is present in. So if there is low level of phosphate, then it activates the 1-alpha hydroxylase that is present in the kidney, and it converts this 25 hydroxycholecalciferol into the 125 dihydroxycholecalciferol, and vitamin D is synthesized. Okay, similarly, if there is a low level of calcium, okay, there is low level of calcium, what will happen? First, the low level of the calcium will stimulate the parathyroid hormone to synthesize this parathyroid hormone. Okay, it stimulates the parathyroid gland to synthesize this parathyroid hormone. Okay, and this parathyroid hormone then activates this 1-alpha hydroxylase enzyme, which is present in kidney. That means the phosphate have direct effect on this 1-alpha hydroxylase, whereas the calcium have indirect effect via this parathyroid hormone. Understood? And similarly, this calcitriol, okay, it have the negative feedback mechanism. If there is high level of the calcitriol, then it inhibits the enzyme 1-alpha hydroxylase and inhibit the synthesis of calcitriol itself. Like other hormones, there is the negative feedback mechanism. Okay, understood? Regulation, it is mainly regulated by the plasma level of calcium and phosphate, as well as there is negative feedback by the calcitriol itself. Okay. Now coming to the mechanism of action of calcitriol. Okay, calcitriol, once it reaches into the target cells, okay, once it reaches the target cells, then within the cells, it has its receptor mainly in the cytoplasm. Okay, calcitriol has its receptor in the cytoplasm. It binds to its receptor and it forms the hormone receptor complex. Okay, hormone receptor complex, and this hormone receptor complex then enters into the nucleus. Okay, and first it dimerizes. Okay, it undergoes heterodimerization with retinoid X receptor. Okay, retinoid X receptor, and once it forms this heterodimer complex, okay, and co-activators, it also binds with the co-activators. Okay, and both of these heterodimers then bind with vitamin response like other, okay, like other hormones, okay, like other steroid hormones, it has similar effects. Have you studied about the steroid hormones? Mechanism of hormones? Hello?
No, ma'am.
No, ma'am.
No, ma'am.
No? I studied about the hormones? Okay. Okay, because the mechanism action of this vitamin D is similar to the mechanism action of steroid hormones. Okay, so what will happen? As I said, once vitamin D, okay, vitamin D is activated in the kidney, then it is transported to the different target cells, right? So in the target cells, once it reaches the target cell, first it binds to its receptor, which is present in the cytoplasm. Understood? In the cytoplasm, it binds to its receptor and it forms the hormone receptor complex. Hormone, and this is receptor, which is present in cytoplasm. It forms the hormone receptor complex. Once this hormone receptor complex is formed, then it enters into the nucleus. Okay, in the nucleus, first it forms heterodimer. Okay, heterodimer with retinoid X receptor, and both of these complex bind with vitamin D response element. VDRE means vitamin D response.
Ma'am, you are muted.
Hello?
Yes, ma'am.
Hello?
Yes, ma'am.
You all can hear me. Okay.
Yes.
See, as I said, this vitamin D once binds to its receptor that is present in the cytoplasm. Hello?
Yes, ma'am, you're audible.
Hello?
Yes. Yes, ma'am.
Oh, okay. This hormone complex then enters into the nucleus. Okay. First, it forms heterodimer with retinoid X receptor. Okay. Then it binds with vitamin D response element, which is present in the DNA. Then it binds with the co-activators. Then co-activators, it initiates the transcription. Okay, now the messenger RNA is formed, and this messenger RNA then it leaves the nucleus and it undergo translation. Okay, translation process and leads to the formation of proteins. Especially the calcitriol will form the proteins like calcium binding protein, which is known as cal binding. Okay, in the intestine, that is the absorption of the calcium from the intestine. So it will have its different biochemical action of vitamin D. Similarly, it has its action in the intestine, in the bone, in the kidney, right? So this is the mechanism action of vitamin D, calcitriol. Understood? The transcription, then translation and formation of the protein, and that then it exerts its biochemical function. Okay, in the different tissues. Now coming to the biochemical function of vitamin D, okay, overall function of the active form of vitamin D is to maintain the adequate plasma level of calcium. Okay, now coming to the action of vitamin D on example, as I said, once vitamin D, what will happen? Vitamin D, for example, vitamin D is acting on the intestines. So what will happen? First, it enters into the intestinal cells, then binds to its receptor that is present in the cytoplasm, right? Then it forms the hormone receptor complex. Then hormone receptor complex then enters into the nucleus. First, it forms the heterodimer with retinoid X receptor. Then it binds to the vitamin D response element, which is present in DNA, and it also binds with the and it initiates the transcription, and then translation leads to the formation of different proteins. For example, in case of the intestine, it leads to the formation of the protein like calcium binding protein. Okay, so because of this formation of this calcium binding protein, there is absorption of the calcium and phosphorus from the intestine. Understood the role of vitamin D? Basically, it helps in the absorption of the calcium and phosphorus from the intestine. Coming to the action of vitamin D on bone. Okay, it usually increases the activity as well as the number of osteoblasts. You all know osteoblast is the bone forming cells, and similarly it also have role in osteoclastogenesis. That means, what is the role of osteoclast? It helps in the bone. What is the role of osteoclast?
Bone resorption.
Bone resorption.
Bone resorption. Yeah, bone resorption. Okay, that means the vitamin D. Okay, vitamin D have role in both the bone formation as well as in the bone resorption. Basically, it helps in the remodeling of the bone. Okay, so basically what it does, vitamin D, it stimulates the osteoblast to secrete the alkaline phosphatase. Alkaline phosphatase, it is an enzyme. Okay, that removes the phosphate from the bone. If the phosphate is removed, obviously the calcium is also removed from the bone. Okay, so the ionic product of the calcium and the phosphorus is increases, leading to the mineralization and remodeling of the bone. That means the main role of vitamin D is basically in the remodeling of the bone. That means it have a role in both the bone formation as well as in the bone resorption. Depending upon the ionic product of the calcium and the phosphorus, it helps in the remodeling of the bone. Okay, now action on the kidney, this vitamin D, it increases the reabsorption of the calcium and phosphorus. Okay, so so what is the role of vitamin D on intestine? Can you tell me what is the role of vitamin D on intestine?
Increases calcium absorption.
Okay, basically it has the calcium and phosphorus. Okay. In kidney, it has the reabsorption. Okay, reabsorption of calcium and the phosphorus. Now, vitamin D is a hormone. Then why vitamin D is a hormone? It is considered as a hormone. Do you have any idea why vitamin D is considered as a hormone?
Because it does fatty like calcitonin and parathormone.
Because like other, okay, just listen to me carefully, okay. Sorry? I can't hear you.
Maybe it circulates in the blood and acts on almost every cell.
Yeah, okay. Because it is synthesized in skin, right? Yeah, it is synthesized in skin, and it is transported to first in the liver and then into the kidney. It is activated in kidney, okay? And its action is similar to that of the steroid hormone, right? The mechanism of action of vitamin D is similar to that of the steroid hormone, okay? And it have, like other hormones, okay, it has its action on the intestine, on bone, as well as in the kidney, okay? Understood? It is synthesized in the skin, then its active form is formed in the target organ where it exerts its mechanism of action, okay? And similarly, its action is similar to the steroid hormone. We have already discussed how calcitriol have the mechanism action that is similar to the steroid hormone, okay? And it is also self-regulated by the feedback mechanism. There is high level of the calcitriol, then by the negative feedback mechanism, it inhibits the 1-alpha hydroxylase, which is present in the kidney, right? So, like other hormones, it also have a self-regulated feedback mechanism. Okay, these are some few reasons, okay, why vitamin D is considered as a hormone. Now coming to the requirements of vitamin D, okay, these are the requirements for children, adults, okay, for the pregnancy and lactating women, and above the age of the 60 years and above. Okay, these are.
Again, ma'am, you have been muted by someone.
It's okay now? Hello?
Yes, ma'am.
Okay. These are the sources of vitamin D. Egg yolk, fish. Okay. Milk is a poor source of vitamin D, and similarly the butter, mushroom. Now coming to the deficiency of vitamin D. Okay, deficiency of vitamin D leads to the rickets in children and osteomalacia in adults. Okay, so what are the causes of vitamin D deficiency? Mainly it occurs in people who are not exposed to sunlight. Okay, especially those patients who are bedridden. Okay, the patients who are bedridden for months, for years. Okay, if they are not exposed to sunlight, then that leads to the vitamin D deficiency. Similarly, in case of in the winter season. Okay, in the winter season, and those who cover their whole body. Okay, cover their whole body with clothes, they also suffer the vitamin D deficiency. Okay, and nutritional deficiency of the calcium or the phosphate may also produce the similar clinical picture. Okay, like vitamin D deficiency. Malabsorption of vitamin, as I said, in obstructive jaundice. In the obstructive jaundice, what will happen? The bile is not. What will happen in obstructive jaundice? Bile is not secreted into the duodenum, right? And you all know bile is very, very essential for the absorption of the fat as well as the fat soluble vitamin like vitamin D. Okay, so there is, in that case also, if there is obstructive jaundice, there is no bile and there is no absorption of vitamin D. Similarly, in this dysautoria, it is a condition where there is excretion of excessive amount of fat in the stool. In that case also, because of the inability to absorb the fat and the fat soluble vitamin, there is deficiency of vitamin D. Okay, malabsorption syndromes. And similarly, the high phytate content in the diet also reduce the absorption. Okay, phytate is present in the nuts, in the grains. Okay, if there is high amount, then that also reduces the vitamin D absorption. Okay, and similarly the abnormality of the vitamin D activation, because the vitamin D activation, vitamin D, though it is synthesized in the skin, it is activated, it undergoes first the 25 hydroxylation in the liver and then the 1 hydroxylation in the kidney. Okay, if there is liver and kidney disease, then it retard or it affects the hydroxylation reaction, so there will be no activation of vitamin D. Now coming to the clinical features of rickets. Okay, as I said, rickets occurs in the children and osteomalacia in the adults. There is incomplete or insufficient mineralization of the bone, because of which the bone will be soft and pliable. Okay, and the plasma calcium and the phosphorus level will be low. Okay, but the alkaline phosphatase, which is the bone isoenzymes, it is markedly elevated. Okay. What is the role of alkaline phosphatase? It removes the phosphate from the bone. Okay, so the classical features of the rickets are deformity. The weight-bearing bones are bent. Okay, and it includes the bow legs. If you see the figure here, bow legs. This is the figure showing bow legs. Okay, this is the knock knee. Okay, the weight-bearing area of the bone will become bent. Okay, bow legs, knock knee, rickets, rosary. See, if you see this figure here, can you see the bead? These are the ribs. Okay, these are the ribs, and at the end of this, okay, there is at the ends of the epiphysis there is formation of ricket rosary. Okay, rickety rosary and bossing of the frontal bones as well as pigeon chest. Here, this is pigeon chest. Okay, these are some clinical feature of rickets. Similarly, the craniotabes. Okay, it is an early sign. See here, it is an early sign, usually affecting the occipital and parietal bone along the lamboidal sutures. Okay, because of the incomplete mineralization of the bone will become soft. In case of rickets, it is derived from the word ricken, which means twist and or bend. Okay, now coming to the clinical feature of osteomalacia, it is derived from the Greek word osteon, that is bone, and malakia is softness. Okay, the bone are softened due to the insufficient mineralization and increased osteoporosis. Okay, and because of the osteoporosis, the bone is more likely to get fractures. Okay, and there is low level of the serum calcium and the phosphate, as well as there is increased level of alkaline phosphatase. As in case of the rickets, there is low level of calcium and phosphate and increased level of alkaline phosphatase. Now coming to the renal rickets, which is also known as renal osteodystrophy. Okay, it usually results from chronic renal failure, because if the kidney is not working, if the kidney undergo the chronic failure, then there will be no activation of vitamin D. Okay, so that leads to the renal rickets, because the active form of vitamin D occurs in kidney. So in that case, the calcitriol has to be administered. Okay, and it will be effective. Now coming to the hypervitaminosis D, okay, as I said, the vitamin D is stored some amount as well as in the other tissue, mainly store the vitamin D. Okay, among all the vitamin, okay, vitamin D toxicity is very, very common. Okay, if the dose is above 1500 units per day, if it is taken for a long period of time, then it leads to the toxicity. Okay. Include weakness, polyuria, intense speaking, hypertension, and weight loss. Okay? These are the symptoms of hypervitaminosis D. And mainly the toxic effect of hypervitaminosis is it includes the demineralization of the bone. That means it increases the bone, as well as it increases the, what is the role of vitamin D in the intestine? It helps in the calcium absorption, right? So as a result of which, calcium absorption is also increased from the intestine, as well as bone resorption is also there. So overall, there will be increased level of the serum calcium to the hypercalcemia. Okay, if there is calcium within our in the serum, then it gets deposited into the various tissues, especially in the vascular tissue as well as in the kidney. Okay, deposited into the various soft tissue. Okay, and that term is known as calcinosis. And because of the deposition of the calcium in the renal tissue, it also leads to the formation of renal stone, okay, which is known as renal calculi. I think this was for okay. We'll practice some few MCQs. So provitamin D3 is. Can you tell me what is the right answer? Provitamin D. Hello?
C, ma'am.
C.
Okay, we said C. C is the correct answer, okay? Provitamin D3 is 7-dehydrocholesterol, okay? Next is 25 hydroxylation of vitamin D occurs in
Liver.
okay, very good. 25 hydroxylation takes place in the liver, whereas 1 hydroxylation takes place in
Kidneys.
Kidney.
kidney. Tubular reabsorption of the calcium is increased by
Calcitriol.
calcitriol. Okay.
Ma'am,
Because the active form of vitamin D. Okay. Hello?
Yes, very audible.
What happened? Yeah. Okay. So calcitriol. Okay. Calcitriol is the active form of vitamin. So it have one biochemical function in the different tissues. Okay. Not this cholecalciferol, hydroxycholecalciferol. Vitamin D2 is also said to be vitamin D2
ergocalciferol.
Ferrol, which is also the another name is activated ergosterol. Okay, when this ergosterol undergo activation in the presence of the UV light, then it converts into ergocalciferol, which is vitamin D2. Okay, it is mainly present in plant in the east. Okay, it is mainly of plant origin. And next is hydroxylation of 25 hydroxy cholecalciferol is promoted by
C.
C.
D.
Sorry. Okay, what is the right answer? I didn't hear you.
D.
Hello? B.
Cytochrome.
Yeah, parathyroid hormone. Okay, parathyroid hormone. So how parathyroid hormone helps in the hydroxylation of 25 hydroxycholecalciferol? Can you tell me? Parathyroid hormone. I explained you right. If there is a C, parathyroid hormone, it activates the 1-alpha hydroxylase. That means 1-hydroxylase enzyme which is present in kidney. Okay, but this parathyroid hormone is released from the parathyroid gland in the presence of low level of calcium. If there is low level of the calcium in the serum, then it stimulates the parathyroid gland to release the parathyroid hormone. Then this parathyroid hormone, it activates the 1-hydroxylase, which is present in kidney. But the phosphate, okay, if there is low level of phosphate, it directly activates the 1-alpha hydroxylase. That means the phosphate have direct effect on the 1-alpha hydroxylase, but the calcium have indirect effect via this parathyroid hormone. Understood? I think this was for today.